week in September, another educational meeting for our staff. This is actually a presentation that we kind of do annually because we do so many implant parts here. You kind of take it back to the basics and talk about the importance of the interface and the screws. Tell us a little bit about what you talked about today with our team.
Yeah, absolutely. Today was really good to go over everything again. We have so many new people that come in here and new technicians. We always want to make sure that they're aware of the the integrity of the parts, the internal components of these implants that are precision milled, the screws that we have to use, what to touch, what not to touch in the pan. And there's always a lot to go over, procedures on how to protect the interface and make sure that nobody sandblasts the internal component, nobody does anything to the screws that are in the pan for the doctor. We want to make sure that everything is very well protected. So we did a general overview and make sure that everyone is on the same page with what to do.
So protecting that interface is critical to making sure there's no gaps for micro leakage. What are some techniques that we suggest to our people?
So we tell them that if they have to polish it, if there's a custom abutment they have to polish or something, best to just take an analog, a spare analog, and screw it down on the analog. And that way the internal components are protected, then they can polish on the analog. If you don't have an analog, then you have to sacrifice your fingers or something, a piece of tape, anything that can protect that interface so that you do not sandblast from the bottom. You always want to make sure that we're sandblasting it correctly and that you sacrifice your fingernail and thumb if you have to make sure that interface is not touched.
Absolutely, and it was nice that you kind of conveyed that nobody's going to get into trouble for asking for parts to protect the interface. So, gosh, there's so many implant systems we work with at ROE because we do a ton of implants here, and it's really a mainstay of our company. And there's so many screws we have to work with, and they're so small. How do we keep them all straight in the lab to make sure that we're not damaging those screw interfaces?
Yeah, so the job of putting everything in the pan correctly comes down to a few people, and a few trusted people that we know. Knowledgeable people that know how to read the right implant system from the doctor and put it in the pan for everyone to work with. But once it's in the pan, we really have to maintain the integrity of that implant in the pan by not mixing it up with any other implants and one of the other things is really, we created something like this. This is basically a chart that goes in the pan. It's color coded so the technician knows exactly that this is circled. I have to grab the yellow one and use the yellow one with the case.
So that correlates to the color correlates to a driver that they have at the lab that they have to use. So basically all they need to know, if that's checked yellow or blue, grab the blue driver.
Correct.
And only use the blue driver.
Everyone has drivers that are color coded to this, okay? And there's even a picture of the head of the driver.
Oh, that's
so
great.
All you have to do is just look at this paper that's in the pan and just, okay, I'm grabbing the yellow one, yellow one. That way I don't strip the head.
Does that go out to the customer?
This doesn't. This is the internal one, but we do have an external one that goes out to the doctor in the box.
Okay.
So the doctor knows exactly which driver to use. It's also color-coded, but it's also got pictures, and it also actually has the torques, the manufacturer recommended torques. So they could just look at this that's checked, and they know, hey, I'm torquing this one down this much. Sometimes it can get confusing for even doctors. So this is a great.
See, it has both even the prosthetic torque value and an MUA torque value on there too as well.
Yeah, absolutely. I was just trying to make it as simple and as quick for the doctor as we can too. Sometimes
we have doctors that call that ask for that, like, where is that? Because they rely on it. And most of our clients, if they're a Straumann doc or a Zimmer doc, and they're doing this all the time, they know exactly what to use. But sometimes you get odd systems that come in that walk in the door, or a Hyasin, or a different type of system that comes in that they don't normally do, and that's why that really comes in handy.
Yeah, for sure. It definitely helps out. I've heard some good feedback about that form. Yeah.
Now, is that the same for angulated screw channels that are becoming more popular?
Well, it doesn't have angulated screw channels, but we do have another form for the doctor for angulated screw channels. So all the information's there, how to torque it, what driver to use, torque settings for every implant system. So these are becoming much more popular. Doctors don't have to switch to an angled MUA. We can oftentimes fix issues with occlusal holes with these multi-unit screw channel abutments. So, it's becoming more popular, and we're seeing more of it in the lab. So there's another resource.
It's important there. We always having to make sure the doctor has the angulated driver because it's a unique tool with a kind of a ball head on the end as opposed to some kind of straight geometry. So
Yeah, the head of the driver is actually a ball, so they can use it at an angle. And sometimes even technicians will come to me in the lab and say, hey, I can't get this to work. The driver doesn't line up with the implant. And I said, it's a ball driver. Watch, let me show you how it's done. So we go at an angle, and it's really amazing how the ball changes the dynamic there, and they can back it out really nicely. It's good.
Yeah, implants keep getting better and better. Yeah. Well, it's great that we kept our staff, updated with basically the basics of how to make sure we're using the right tools and how to protect the parts through the process. So hopefully these couple little tips about what we do here at ROE can help our clients, and it might be a good video to share with your staff, and recognizing that form and knowing what driver to pull out, when the procedure, the time to use the procedure and screw in an appliance. So.
Yeah, absolutely. There's some good questions today, and there's good discussion too. And I look forward to doing one like this annually. It's good.
Great. Thank you.
You're welcome.
To receive a copy of this lecture, visit www.roedentallab.com/ROE Reviews.